I'm here with Dr. Bridget Walker to discuss her best-selling book, Anxiety Relief for Kids. This is a book full of on-the-spot strategies to help children overcome worry, panic, and avoidance. Dr. Walker, what prompted you to write this book?
Thank you, Lynn. Truthfully, what prompted me to write the book was that I didn't like the books that were out there. I thought they didn't get to the point. And I also thought that parents really needed to understand how anxiety issues work in kids and to know kind of how clinicians such as myself treat these kids in ways that they could use the principles and strategies that myself and other clinicians use themselves.
So, as I know it, you are one of the foremost CBT child and adolescent therapists.
Yeah.
What prompted you to pursue this field of study and this type of work?
Well, I think when I went to graduate school, I learned how to do sort of insight-oriented talk therapy, and I just didn't feel that I knew if I was helping people, and I'm a very practical person. And cognitive behavioral therapy is solidly evidence-based. It's been studied over decades. It continues to be studied and it evolves, so it gets better and better. And so I like to know that I'm making recommendations that have been backed up by solid data.
So if I'm a parent of a child who I suspect may be dealing with an anxiety disorder, what can I hope to find in this book?
Well, you can find what anxiety disorders look like, what they don't. You can find the neuroscience of what's happening in our brains when anxiety is triggered. You can find various ways to respond to your child that are more constructive than maybe ways you are currently. You can even, this book shows parents how to do exposure-based therapy, which is probably the single most effective piece of CBT as it relates to anxiety disorders, and that is gradually having a child face a situation that triggers anxiety while not doing behaviors that they had adopted, safety and avoidance behaviors. So it really walks parents through really how to treat a child. And I get lots of calls from parents saying, well, I read your books and we can't do it. And I think there's some kids who have, I see most of my patients have pretty serious, severe anxiety disorders. And so I'd say parents will probably have better luck on their own with kids who have milder versions, but the quicker you start, in terms of earlier, the less likely these anxiety disorders are going to become severe. So it really varies from family to family, but the book is packed full of this is what clinicians do. This is how we treat this in language that's accessible to parents. I explain in the book how parents can explain why exposures work in kid-friendly language. I use a fear thermometer to have kids rate their level of fear, and kids get it. As young as 5, they really understand everything that's in this book because this is how I practice, essentially.
I'm going to assume that there's a very broad range of anxiety disorders, and certainly if there's a very severe one, that's best served by a clinician such as yourself. But for parents who might be at an early stage of an anxiety disorder or are concerned about some behaviors, is this book going to give them ideas, protocols, modalities to sort of address those?
Well, absolutely, and really parents, they all want to do what's best, and most parents are like, I didn't even realize that responding in this way was not helpful, and so most parents are really happy to avail themselves of the recommendations that are in my books. And it changes people's lives, and family life if there's a kid with an anxiety disorder can be really, really stressful and extremely exhausting. So parents are really motivated not only for the welfare of their child but for the tranquility of their families.
So in my mind, I'm comparing it to parents with very young infants who struggle with sleep. and there's been a real resurgence of sleep coaches and sleep training to help families, exactly like you said, the whole family is better off when that infant is sleeping. So what I'm hearing you say is potentially within this book, there are ways that parents can take back control and in fact have more control in these situations than they think they do.
Yeah, I like to think of it, everyone would love to be able to control their anxiety and their thoughts, but nobody can. But there are things we can do to make it less likely to become disruptive. And so this book offers many examples. I try to use the types of situations that I see most in my practice. Parents can actively use all the strategies in this book.
Give me an example. What's one of the most common anxiety disorders that could be helped through your book?
Okay, let's say you've got a kid who's highly perfectionistic. So people who suffer from perfectionism, they worry about making mistakes or missing an important detail. And a behavior you might see in a child that had those concerns would be, and it's always about things that matter to an individual. It's not about everything, it's only particular things. So let's say you've got a kid who is very perfectionistic about his or her grades, and he does behaviors like checking his backpack multiple times to make sure he has all of his folders in his books, or telling his mother, if he forgot a book, Mommy, did I forget the book? And what a parent can do is learn to coach the kid, use a nickname, for example, say, hey, that seems like worry bug, let's go, and not reassure the kid and not take that extra time. And it's not being mean to your child, it's just being assertive and saying, we're going, and not getting into it with them.
So I like your use of this term worry bug. Is that a strategy that you speak to children about in this book?
Oh yeah, I mean that's one of the first things that I do when I educate kids of all ages about why they're going to do exposures, because why on earth would anyone do something that scared them unless they understood why it was going to help them get better. And I use an analogy of a worry hill.
What is a worry hill?
Oh, so a worry hill is essentially a graphic depiction of showing kids that when they enter a situation, their fear thermometer, their anxiety will increase, and they will want to do a behavior like get out of the situation or not enter the situation. And I will show them that if they do those behaviors, they'll be stuck at the top of the worry hill, and the next time they're in that situation, their fear thermometer will go right back up there. But if they practice staying in the situation and tolerating the worry, their brain learns that they can be okay, and they get to the other side of the worry hill. So you explain that to kids of all ages, and you use a lot of objective things, like what's your fear thermometer, like the worry bug. The worry bug is a nickname is an incredibly powerful tool because it helps the kid remember that this is a worry issue. This isn't a thought necessarily to be taken at face value. Number two, it allows the parent not to engage in accommodation behaviors. So not to reassure, not to, try and rationalize with the kid. So if you just say, hey, John, that's a worry bug, let's go. There's no discussion about, don't worry, nothing bad's gonna happen, it'll be fine. Those are all behaviors that would feed and maintain an anxiety disorder. So there's a lot of tools in this book that objectify the process, because anxiety is pretty intense and it's a pretty strong emotion, and people tend to get very irrational. And so we try and keep it very objective, and kind of a benign business-like attitude is the best, because anxiety can get really out of hand quickly.
There's almost a playfulness about it. Is it something that children take to rapidly? Do they enjoy having this access to these structures and these strategies?
Yeah, they do, and I use a lot of rewards. So I have parents reward their children immediately for even using the tool, for doing exposures, for tolerating it when the parent doesn't engage in an accommodation behavior, which we plan ahead of time. For example, I'll ask a kid, how hard would it be for you if your mom didn't let you check your backpack to make sure you had all your folders? And so it becomes an objective thing.
So Do you feel that any child can really use this, any child without a severe anxiety disorder can use this and find success?
Yeah, most. I mean, there are some kids who just are completely not cooperative, and I always say hostages don't make good patients. And in those cases, I tend to work with the parents to reduce their accommodation behaviors, and that usually works. Everyone's different. Children are unique, each and every one of them, just as adults are. You kind of have to figure out what works for everyone, yeah.
Well, this sounds like a fabulous resource, and I think, would you recommend it to teachers and counselors as well?
Absolutely. It's been recommended, if you see it on Amazon, it's therapist recommended, and it was actually honored by the Association for Behavioral and Cognitive Therapies for an evidence-based scientific book. So I'm really proud of it, and it stood the test of time. It was published in 2017, and it's still a useful resource. It's been translated into 3 other languages too, which is really neat.
Well, congratulations, and thank you so much. This sounds like something every household should have, and it's available on Amazon.com and local bookstores. Thank you, Dr. Walker.
My pleasure.